This is Chicago's very own WGN Midday News.
Once the holiday season gets into full swing, those party invitations start rolling in, and sometimes that means an abundance of food and drink, which can fan the flames of alcoholism and eating disorders. So today we're getting some advice on how to cope with these challenges. Dr. Joy Ryba is a clinical director of Midwest Counseling. Thank you for being here. I think this is so important, and I know you have advice not just for those struggling, but also for family members as well, because I don't think people realize how stressful it is. So you've got all this food, you've got all the cocktails, and you've got a lot of family, which is adding stress at a really difficult time. How bad is that for the people that you have spoken with, that you know who've gone through it?
It can be very challenging. For many of us, it's the most wonderful time of the year, and for some of us, it's not the most wonderful time of the year, and that's okay. And when dealing with alcohol abuse or an eating disorder, it can be especially challenging. Holiday parties, lots of family, lots of food, lots of alcohol, and dealing with some stressful situations can be very difficult.
So for those who are following steps, who really know how to get through, do they alter those around the holidays? I mean, how do you kind of keep the status quo when it's not like every day?
It is not like every day. The best thing that anyone can do if they are in recovery for alcohol addiction or for an eating disorder is have a plan. Have a plan of action and talk to your support system ahead of time of how that plan is going to carry out through the day. So perhaps you have a big family gathering to go to. Know when you're going to arrive, know when you're going to leave. If possible, have your own vehicle so that you can leave if things really get stressful. And the nice thing is most people have a phone now. So if you need to excuse yourself, leave the room, make a phone call to somebody in your support system, you can go ahead and do that.
And I want to talk about that in more depth in a little. First, I want to talk about this concept of talking, because family members are nosy and people ask a lot of questions. So do you have a plan of what to say, or do you just say, no, thank you? I mean, is it best to talk about it or not?
It depends on the person, and I would encourage anyone in recovery, talk with your support people, talk with your therapist, perhaps your registered dietitian, an AA sponsor maybe, and talk about what do you want to say to family members if they comment on your food or they comment about why you're not drinking or ask about why you're not drinking. What is it that you're going to say? Have the script, practice that script. And so if you don't want to talk about it, then you don't have to. You can merely steer the conversation away onto something else, ask them about them, thank you so much for your concern, and then move on to something else.
If you're someone who has a problem with drugs or alcohol or eating disorders, you generally do have support, but they might not be as readily available around the holiday times. Should we designate someone new to be that person? You be my designated person at the party.
I think that would be a great idea. So perhaps you grab a sibling who's supportive. Perhaps you're new in recovery and you don't have a treatment team yet. Somebody that you can reach out to and say, hey, here's what I want to accomplish today. It's really important that I not drink. It's really important that I stick to my food plan. Can you help me with that? Is it okay if I just kind of grab your elbow during dinner? Or if the conversation gets kind of testy and it gets stressful, hey, can you invite me for a walk? Let's go take the dog for a walk. Let's get a break together.
Let's talk about the people who are hosting, because they may not realize that what they're doing is bringing more stress into someone's life who's having challenges. So are there specific things that we can do, even as family members, just to make people feel more confident and not make them feel like an outcast because of their challenges?
Sure. If you are hosting a party and you know somebody's in recovery and you want to make them more comfortable, good for you to begin with, just for having that thoughtfulness at the outset. If you know the person well enough, maybe give them a call and say, hey, is there anything that I could do to make the day easier for you, more comfortable for you? And if the person says yes, then see if you can accommodate that. And if they say no, then just let it go and relax and let the person enjoy themselves. And not drawing attention to it sometimes is the best thing to do.
Is there anything that relatives can do specifically right now to help, to say, okay, just breathe, it'll be okay?
Just breathe, it'll be okay. Take a minute, tell us what you need. We'll be as supportive as we possibly can. You know your recovery better than we do, so tell us what you need. And if you communicate with us, if you're that support person, be willing to just follow that person's lead.
Right. Listen, a lot of times is kind of the most important thing. Thank you so much, because I think it's so challenging and so important at this time of year. Midwest Counseling is at 650 North Dearborn Street in Chicago. If you want more information, you can visit MidwestCounseling.com. And if you want to share this interview with someone you know. Go to WGNTV.com/midday and we will have all of that there.